Imagine that tomorrow your government announces something that sounds impossible. Every citizen will have access to health care, no matter your income, no matter your job, no matter whether you can afford insurance. You can go to a hospital, see a doctor, receive treatment, and in many cases, pay nothing at the moment you receive care. For millions of people around the world, this sounds like a dream. But in Brazil, a country with one of the largest public healthcare systems on earth, there is a surprising debate. Some Brazilians defend this system as one of the country's greatest achievements, but others ask a different question. Is free healthcare worth the taxes required to maintain it? Some people even argue, I would rather keep that money and buy something I choose. A new pair of shoes, better food, a trip, something for my family. So today we are going to explore a fascinating question. Why would some Brazilians choose personal spending freedom over guaranteed health care? And more importantly, would Americans make the same choice? Before understanding this debate, we need to understand what Brazil's healthcare system actually is. Brazil has something called SUS, the Unified Health System. Created in 1988, after the country's return to democracy, SUS was built around one central idea. Healthcare is a right of every citizen. Unlike countries where healthcare access depends mostly on employment or private insurance, Brazil created a system where every person can receive medical care through the public network. SUS provides emergency care, vaccination programs, medical consultations, surgeries, cancer treatments, organ transplants, and many other services. It is one of the largest universal healthcare systems in the world, serving a population of more than 200 million people. To understand the scale of this, imagine if the entire population of the United States had access to the same government healthcare system. That is the size of the challenge Brazil faces. However, there is something important to understand. Free healthcare is not actually free. The patient may not receive a bill at the hospital, but the system is financed through taxes. The government collects money from society and uses part of it to maintain hospitals, pay healthcare professionals, buy medicine, and operate the entire structure. And this creates a fundamental debate. How much responsibility should belong to the government, and how much freedom should belong to individuals? Supporters of SUS argue that healthcare should be seen as an investment, not just an expense. Their argument is simple. A healthier population is a stronger economy. When people have access to treatment, they miss fewer days of work. They recover faster. Families avoid catastrophic medical expenses, and people are able to continue participating in society. Some economic studies in Brazil have suggested that investments in public healthcare can generate economic returns beyond the healthcare sector itself. One analysis published by Brazilian newspaper Folha de São Paulo highlighted estimates that every additional Brazilian real invested in public healthcare could generate more than 1 real in economic activity. The idea is that healthcare spending can create jobs, stimulate businesses, and prevent losses caused by untreated diseases. From this perspective, healthcare is not only about saving lives, it is also about building a productive society. But here is where the debate becomes interesting. Not every Brazilian sees taxes the same way. Some people believe that government programs become too expensive and inefficient. Their argument is based on personal freedom. They ask, if I work hard for my money, shouldn't I have more control over how it is spent? For someone young and healthy, who rarely visits hospitals, paying more taxes for a healthcare system may feel like paying for something they don't personally use. Their idea of freedom is different. Freedom means having more money in their own hands. Freedom means choosing whether to spend on education, travel, business, clothing, food, or personal goals. From this perspective, the government should take less money from citizens and allow people to make their own decisions. But supporters of public health care respond with another question. What happens when life changes? A healthy young person today may not need medical care, but tomorrow they could face an accident, a serious illness, a diagnosis that costs thousands of dollars. Healthcare is unpredictable, and this is the foundation of universal healthcare systems. You are not only paying for yourself, you are creating a safety net for society. Now let's bring this conversation to the United States. The American healthcare system works very differently. Many Americans value having more choices, competition, and private options. But the country also faces debates about healthcare costs, medical debt, and access to treatment. So here is the question. If the United States created a universal healthcare system funded by higher taxes, would Americans accept paying more? Or would many people prefer keeping that money and choosing how to spend it? Would you trade a little financial freedom today for guaranteed healthcare tomorrow? Or would you rather maintain control over your own income? The Brazilian healthcare debate is not simply about hospitals or medicine. It is about a much deeper question. What does freedom really mean? For some people, freedom means keeping more of your money and deciding what to do with it. For others, freedom means knowing that a medical emergency will not destroy your financial future. Brazil and the United States approach this question differently. But perhaps the most interesting part is not deciding who is right. It is understanding why reasonable people can look at the same issue and see completely different answers. So now, I want to ask you, would you trade some of your spending freedom for guaranteed health care? Or would you rather keep that money and make your own choices? Let me know what you think.